Hello, this is Claire Ruberg here to talk to you about anxiety and depression. Many people use these terms to express that they feel sad or stressed, overwhelmed, as in, I'm so depressed Kroger didn't have my favorite ice cream, or my anxiety is so bad this finals week. While we can be anxious without being clinically anxious, I think it's important to understand what true clinical symptoms of anxiety and depression are and ways we can help. Let's start with depression. Feeling sad sometimes is not only clinically appropriate, it's actually mentally healthy. For example, if you were not sad about the death of a pet, that would be concerning. In a depression diagnosis, we are looking for a pattern of being sad more often than not without a life event for over 2 weeks. Additionally, depression can present with a loss of interest in things you used to enjoy or loss of motivation, changes to your sleep patterns or eating habits, psychomotor retardation, moving so slowly that other people notice, fatigue even when you are sleeping enough, feelings of worthlessness or guilt, indecisiveness, and even recurrent thoughts of death or suicidal ideation. With sadness, we expect the feelings to go away over time, but depression typically needs some form of treatment like therapy or medication or both to resolve. Clinical anxiety also differs from feelings of anxiety, stress, or being overwhelmed. In the latter, we expect the feelings of anxiety or stress to leave as soon as the stressor leaves. For example, you automatically feel better when finals are over, you feel less stressed or overwhelmed when a project is completed. With a generalized anxiety diagnosis, those feelings of anxiety don't go away when the stressor leaves, and people tend to feel chronically anxious for a period of 6 months. In addition, they have difficulty controlling the anxiety or worry, and may experience symptoms like sleep disturbance, psychomotor agitation, moving too fast or fidgeting, feeling irritable, muscle tension, and issues with concentration. If you recognize these signs or symptoms in yourself or a classmate or friend, please know that there are things we can do to help. There are many therapy strategies that can help and don't necessarily require years of therapy. Some can help in just 1 semester. The best way to find out what might be right for you is to schedule an appointment with one of our campus counselors to see if you do in fact meet the symptoms and talk about different treatment options. Both of these, generalized anxiety disorder and depression, are very treatable, especially if you come in early. Please don't hesitate to reach out to us.